Hey parents, so I want to talk a little bit about options and things that you can do for your kids with and or without medication. So I had a little one come in the other day and he was just off the wall, off the wall, just like a tiny little tornado in my evaluation room. And we were able to do most of the test because I had to give him a break. So he would do one activity and he would do 5 jumping jacks. One activity and he would do 5 like wall push-ups or up and down jumps or different things like that because he needed to be in constant movement. And he did actually much better once we did like pushing type movements where he's using his body. I forgot what that's called right now. Anyway, I went out and I talked to mom, and mom's insanely frustrated. She's just like, I don't understand. He's on the max dosage of meds that they can give him. Like the doctor at this point has told her there is nothing else that they can do. He cannot be on any more medication than what he's on currently. And I was like, okay, understood. That's fine. I don't, have anything to do with medication management. That's not my area. What I will talk to you about is the fact that this child is seeking sensory input. Like he really needs a good occupational therapist to work on that. We need to work on finding ways for him to know when he needs a break and he needs movement and he needs deep pressure and he needs different things like that. So that's not something that I'm qualified to do. I know what it is, but it's not my area. So I will refer you to an occupational therapist to work on that. And he really needs to work on some different areas. He needs a little bit of social skills training. He needs different things that she had never heard of before, ever. So I'm talking to her about occupational therapy and she's like, what? I'm talking to her about social skills. I talked to her a little bit about diet and sleep because once we went into that area, we're realizing that he gets absolutely no sleep. His diet is terrible. He only craves sweets. So, okay, let's go down the line and let's figure this out. What I'm concerned with is the fact that doctors haven't even mentioned any of this. So they went to medication and they're upping medication and mom is at the point of absolute frustration. But there's nothing happening. Actually, we've calmed down a little bit with the medication, but the behaviors and everything else are still there because no one's addressing any of these other areas. We're not working with him as a whole. We're working with him in this one specific area that he's having difficulties with, but we're not looking at everything else. We're not taking that whole child approach to figure it out. So I just want to let you know that yes, there are meds out there. And for some people, that's all they need. For some people, they seem to really click and all of a sudden it helps with focus, attention, memory, impulsivity, yada, 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 and we're good to go. For some kids, that's not the case. For some kids, the medication is going to help them, do better in school for a short amount of time, and that's about it. And then there's other people where it's not going to work at all. But we also need to look at the entire child. We need to look at what is happening with sleep. We need to look at diet. We need to look at their overall structure. We need to build skills that are going to help them in the long term. Because if they don't build these skills now, when they get to be an adult and they don't have meds in their system, or they get to be an adult and they haven't really learned to regulate themselves, they're going to be a hot mess. So let's look around at this point in time and see what alternatives there are. I'm, like I said, not the doctor. I don't prescribe your meds. That's not my area. But I will tell you that there are a lot of different things that you can do alongside with medication. Or if you choose to not medicate, there's things that you can do instead of medication. But they're still out there, whether you choose to do them or not. Go ahead and tap into them. It's not going to hurt. None of these things are lethal. You can still look at other options.